Welcome to Getting Better with Dr. Adam. Dr. Adam Silberstein is a clinical psychologist who has been working in the field since 1993. With a broad range of clinical experience, including state psychiatric hospitals, adolescent residential treatment with a trauma focus, the Department of Corrections, and in the addiction treatment arena. Adam is currently in private practice and serves as a clinical consultant and supervisor for a number of treatment centers.
Listen up to this one. I just met with Marnie Breeker. She's a licensed marriage and family therapist, a certified sex addiction therapist, and a certified clinical partner specialist, and the clinical director and founder of the Center for Relational Healing. Here's the interesting discussion, right? Who wants to be the therapist who handles when there is a betrayal in a couple? That one of the partners has been betrayed through infidelity of some kind. And just really came to light for me, what a terrible impact that is on the betrayed, and how prior schools of thought or approaches may not have been as attuned to the impact of the betrayal. And what Marnie really brought home was how to create an atmosphere of, or restore an atmosphere of trust and security in a relationship, and that it is possible if there are willing partners that are sensitive and very, very engaged in their recovery. It's totally possible to heal a relationship. Marnie went through the gravity of the betrayal, the nature of the trust rebuilding, and how couples heal when they work with her. Fascinating discussion, and also I think it's important. She focused on what healthy relationships look like, and what preventive measures could be done to help restore a sense or build a sense of safety in a relationship.
This podcast is for general information and entertainment purposes only. This should not be considered treatment advice, nor is it a substitute for an individual treatment plan. If you have questions or concerns about your individual situation, it is strongly recommended you consult a licensed professional to talk about things that are specific to you. If there is an emergency, it is strongly recommended you seek treatment at your nearest emergency room.
So today I am trying something entirely different. I'm here with Marnie Breeker, and we're going to have an interesting talk about working with difficult couples challenges, not difficult couples challenges. And I am, for the first time, portable. So, which is kind of cool. Usually we do it at one place. I brought this to your beautiful office, and much appreciated.
My pleasure.
So I'm looking, and I was reviewing your website and listening to your podcast, and I thought it would be helpful for me. You have so many acronyms, right? It's LMFT, CSAT, CCPS, MA, and so forth. So I thought it would be helpful for you to tell us a little bit about what it is. What are all these letters?
Sure. So, LMFT is licensed marriage and family therapist, and MA is just my master's in clinical psychology. But the two I think of more that are more important for our conversation are the CSAT, which stands for Certified Sex Addiction Therapist, and the CCPS, which stands for Certified Clinical Partner Specialist.
Okay, so tell us a little bit about those things. Are they related to each other? Do you need one? Do you require one to have the other? How does it work?
It's a great question. You are not required to have one without the other. However, in my opinion, not having the information on the partner, the piece about working with the partner the partner who's been betrayed, mm-hmm. right, is a detriment, even if you are an expert in working with sex addiction or betrayal. So for me, I feel that those things go hand in hand, and I think it's why it allows me to work the way that I do with couples.
So I'll tell you why this is so interesting to me. I've been in practice for a while, and I get the sense that you do the thing that I don't want to go near, right? Right? I get the sense that you're invested in so like I'll get calls periodically, do you do couples work? And I'll listen really carefully and I'll say, sometimes, nah, like it sounds super volatile.
I love your honesty about it though.
Yeah, it sounds, I can, but it's like, do I really want to? Or if it's just like, we got to get on the same page with the kids. Mm-hmm. Perfect, mm-hmm. Right? I'll take, like, I'm disappointed you're not paying attention to me, but you'll take one of the partners just had a affair that got discovered, mm-hmm. and there are kids and, the whole house is coming down.
Absolutely.
Right?
Yeah.
And that's fascinating to me because I don't remember a course in my training which said, what's the playbook for that?
There is none. I didn't get that either. And I wish that I had.
Right. So I think about that, and I was listening to some of your work and your podcast, and just thinking, okay, and we were talking about it before. So I get who walks into your office, right? I get who walks into your office is a couple, some sort of couple situation where there's been a betrayal and it's been exposed, maybe for the first time, maybe not, but whatever it is, it sounds fresh and it sounds volatile, right? So I was thinking for my own education, when I think of this, is once it reaches that point, right, where there's a betrayal, something's gone very wrong. Right? There could be a pathway of sex addiction. There could be a pathway of a stale marriage, right? There can be a deadening that isn't sex addiction, but a sort of a distance, right? To use our current word, social distancing gone wrong, mm-hmm. Right? Social distancing on steroids isn't good for a marriage, right? So there could be different avenues that bring people into your office, right? So, but before we even go there, I think for me, it's helpful to think of, okay, that's the problem. What does the paradigm of health look like in a couple's relationship?
So that's a great question. I would say, to me, it's one that's based on trust, and which might sound so, of course, that's not very, that's not really astute or profound, but truly, trust goes so much deeper than I think we often realize. A relationship where there's trust that the other person has my back, the other person's going to keep me safe, and certainly not jeopardize my mental, emotional, physical, sexual well-being, right? A healthy relationship promotes self-esteem, right? It's all about bringing out the best in another person. It's about leaning in instead of moving away, like that social distancing you were talking about when times are hard, right? It's pushing forward in the face of adversity. It is not leaving when things get difficult. It's where two partners have an equal partnership, mm-hmm. And hopefully I say equal partnership. Yeah, it's 50-50, but it doesn't mean that when one person is really high up here in distress or something, that the other person, can't be feeling okay. Like, they don't have to be on the same page all the time and putting in the same effort all the time, but generally it equals out to 50-50. Right?
So that we're both in this together situation,
mm-hmm.
right? And that we are equally both feet in,
yes.
Right? It's that there's a real sense of we're both feet in. But what I'm hearing in that is that the backbone of it is has a certain type of integrity.
Yes.
That is not just, I don't cheat on you.
Correct.
Right? Not that, it's not that just, not that there's not that it's not just a sexual, you can be, I'm safe out there. It's my word is my bond. And that there's a certain level of honesty that that is a part of the entire package.
Yeah, and I actually should have said right at the beginning when I said trust, I would put safety right up there with that. In a relationship, attachment wounds are obviously a huge part of dealing with betrayal. And attachment wounds happen specifically when there's an expectation of trust in a relationship, and then that is violated. So we don't really have these attachment bonds with, let's say, our neighbors, right, or coworkers. Not to say that we don't have some level of trust and care, but really we're not going to have a huge attachment rupture, attachment trauma from feeling betrayed by a neighbor or someone that when there's not an expectation of safety. But that's why when you think about our greatest wounds come from, right, if our parents, if we haven't, if we're hurt, or have attachment trauma with a parent, there's a huge expectation of safety in that relationship.
Right. So for the record, it's not us people who work in mental health just ragging on parents.
No.
We're not just bashing them and saying, blame your mom. Because a lot of people say, oh, what are you going to do? You're going to blame mom and dad. What you're saying is those happen to be the relationships that require the most, I got your back.
Exactly. And that's why when couples are dealing with betrayal, it is so completely earth-shattering because there is absolutely an expectation of safety in that relationship.
Right. More so than other relationships, like you're saying, that I may be connected to my boss, but I don't have the same level of you've got my back.
Right. You might be really upset and distressed and hurt and angry if you feel betrayed by somebody. But that's different than experiencing betrayal in the context of a relationship where you're literally expecting somebody to keep you safe. Someone has made it clear there's a contract, right? It might not be a written contract, and it might be, but there's a contract and an expectation and understanding. Yeah, we're gonna keep each other safe.
So just for my own education, when you say that the moment of betrayal is this devastation, is there an argument to be made that the person starts seeing that there was so many red flags prior to the moment of awareness or do you usually see people like it's a brand new thing and they just walk in and say, I can't believe this, you betrayed me? Or do they usually say, so many things led me to believe this is possible and now it's confirmed?
So another great question. What I would say is it really depends on what is going on with the particular couple that's coming in. And I see all of it. So I'll have very specific sex addiction cases where a lot of the times there were no red flags and partners are truly blindsided and stunned because addicts, as you know, are incredibly gifted and skilled at hiding their behavior and going to whatever lengths they have to hide their behavior so they can continue doing it. So yeah, I've had tons of couples where you've got partners who are absolutely stunned, shattered, shocked, and had no indication whatsoever that anything was happening.
Like a true sucker punch, blindsided.
Completely. And where they will say over and over, I never saw this coming. I don't understand it. I still can't believe it. There were no red flags. And then absolutely, I see other couples where, partners will talk about the fact that they did see some red flags and they might have asked their husband or their partner about it. The problem is oftentimes what accompanies betrayal is so much gaslighting. And, if a partner is made to feel like they're crazy for asking, then eventually they might just stop. And something I think is really important when we talk about this topic is, we all have this second brain in our gut. It's our gut instinct, right? And it's our survival response. It's what keeps us safe. And I think it's really important that we all have that, like this gut instinct. Well, when somebody experiences betrayal or thinks betrayal might be going on, they get into a situation where either their own gut instinct and second brain is going to be eroded or their trust in their partner is going to be eroded. So basically, whatever that relationship is to their second brain, it's going to be destroyed in some way.
So my instincts will start to speak to me, my gut feeling, and I may just shut it down?
Correct, because you need to believe that the person that you love more than anything, the person who you have a family with, who, the father of your kids, you want to believe in that person. So you might have to start to doubt yourself in order to believe your partner.
Sometimes I've seen cases where everybody knows before the other person, and maybe that's what you're talking about. Like I'm thinking of a husband-wife couple where wife was sort of the last one to know. Maybe on some level, she just was doing what she needed to do.
Yeah, I hear people talk about they'll sort of use Stockholm syndrome as a metaphor here, or not a metaphor, but it's a common, I don't know the word I'm looking for, analogy. Yeah, where it's like, well, someone will believe the unbelievable or love the person that they love the most, right? Because they have to believe that they're safe. They have to trust in this person for their own physical, emotional well-being.
Right.
Right. So it's like battered women's syndrome. Is that the right term?
Yes.
Yeah. Like having to to keep going back, to still love, to not believe, that somebody could be putting us in that kind of danger.
So historically, in the evolution of psychotherapy, and I read something that you've had this discussion before, in the evolution of psychotherapy, and you have so much compassion to the betrayed, right? Mm-hmm. that's not a given in the field of the history of the evolution of couples counseling.
Correct.
So what was old school prior to this work being developed?
So traditionally, partners of sex addict were sort of an add-on to their husband's treatment. It was very much from the traditional AA model, where all of the attention went to the addict and the partner was sort of left behind. And when she did get some attention, she was immediately labeled a codependent, borderline personality disorder, or just plain crazy. And the reality is, and I say this all the time, I think when anybody experiences trauma, we can all look crazy. Trauma has symptoms that can make us look crazy. I mean, I can say for myself, I've certainly felt crazy at times of trauma in my life. And I'm sure I looked equally as crazy.
So, and help me distinguish this. You're talking about the context of the discovery of someone who is with a sex addict, and the addict is getting all the attention. That's one path. But there's another path that isn't the sex addiction path. It's the path of social distancing, where the person's not a sex addict. Let's say I'm a doctor and I fall in love with my nurse, who's wonderful and who's everything and who gets me, but my wife is constantly critical of me and so forth. And I feel and still there's that moment of betrayal. There's that moment of betrayal. In that experience, have you seen this where it's sort of it's not a pattern, but it's a one. It happened.
An isolated incident of betrayal.
Incident that happened that isn't in the context of a sex addiction treatment.
So, Adam, I see that all the time. And what I can tell you is that while the treatment for the person who has done the betrayal will be different, obviously a sex addict is going to have a very different treatment plan than someone who comes in, whether it's a male or female, who has cheated, has this, like the social distancing you just described, made a really bad decision. But the impact on the partner who has been betrayed is the same. And that's what's more important to recognize in all of this.
So in traditional, this is what I'm going after. I get that with addiction, because I work in addiction, there's so much focus on, not that the addict doesn't have personal responsibility, but, oh, I get it. He or she's an addict, right? He or she's an addict. Well, i.e., therefore, bad shit's going to happen, right? There's going to be a lot. Of course that happened. Hey, what did you expect?
It's an addict.
And look you're trying to control it, blah, 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 to the spouse. I get that. I would imagine that in the other avenue we're speaking about, it doesn't have, you're not talking about the betrayer doesn't get that compassion.
The pass.
You don't get a hall pass if you are in a social distance marriage. It doesn't have the backing of and the allegations of you spouse, the betrayed must be crazy or borderline. Right. So that I was wondering if that was different when they walk in the office. Or is it just what you're saying, the betrayal is the betrayal?
I would honestly say that for the partner, the betrayal's the betrayal. I don't think that this is for the person who's done the betraying. It does look different for them. They present very differently. The partners don't present that differently. I see partners equally as shattered when there's been an isolated instance of betrayal as somebody who comes in and learns through a formal disclosure that their husband has had sex with 90 prostitutes and has been looking at, porn every day, for their entire marriage, and they never knew anything about it.
Wow. So in that moment of betrayal, and what I really want to come home is part of what you've, as a mission, done is it sounds like you're trying to change the culture of, instead of pathologizing the betrayed and say, well, what's your part in it and so forth. Not that you're not going to go there if there is a part, but you want to be able to at least say it's the worst fucking thing to be betrayed.
Absolutely.
Right? I mean, you want to really punctuate that and drive that home, that getting cheated on sucks.
Yeah, I mean, I've seen quotes from partners that said things like, finding out about the addiction or about the betrayal was like coming home to your house burned down. Everything's gone and the person you love the most is dead. Because they feel like, I don't know this person. This person is a stranger. The person I know would not do this. This is not congruent, right? So everything's gone.
Right, and I'm thinking here, no matter what the couple's issues were, whether they're fighting a lot, whether there's passive aggressive jabs, distance, alienating, public humiliation, whatever it is, right? What I'm hearing is I still have to take it very seriously that level of betrayal is a big deal.
Huge. And also on some level, I always tell people you give up the right. If you are in one of those social distancing, disconnected relationships and you feel like your partner's critical of you and not giving you the attention you need, or you just don't feel as close, and you find that in another relationship with another person, that person gives up the right when you enter therapy and the betrayal's been discovered to now say, but let's talk about how disconnected we were and how my wife was, not meeting my emotional needs. It's like, no. From a relational triage perspective, your partner is now hemorrhaging, right? Based on the discovery of your betrayal. So we need to tend to her wounds first and get things really stable. And then we'll get there. Eventually, to heal this marriage or this relationship, we have to get to those relational issues that might have played a part in somebody making the choice to be unfaithful.
I'm thinking as a flood of images of past sessions are coming into my head, and not specifically for sex addiction, although it was probably co-occurring substance and sex, right? That they really went hand in hand. And I'm thinking of countless people coming in, launching at their partner very quickly into the process of discovery, saying, but you always, what's the statute of, I've heard people say, what's the statute of limitations? How long does this go? How long do you get to clobber me?
And what I would say is immediately, well, as long as this is going on, as long as you're asking me that very question, it's going to continue for a long time. It's not usually about an amount of time. It's about what's happening in that time. And a remorseful partner who recognizes what he has done and the trauma that he's caused, that's going to say, over and over again, I'm going to fall on my sword. I'm going to tell you every day that what I did was horrible, and I completely violated your trust. I destroyed your ability to feel safe, and I will do everything I can from this day forward to keep you safe and do it differently, right? But it's the relationships where the person's going, when are you going to move on? When are we going to have sex again? When are you going to get over this?
So in my experience, the reflex to say, when are you going to get over this, is almost, I can't think of a case when they didn't in the world of addiction.
Right.
Right? I don't really deal with the other avenue we were talking about. That doesn't come to me because I'm mostly in the world of addiction. But I think I'm at 100%. Does that surprise you?
No, not at all. Not at all. And I'm an objective person, right? As a therapist, I'm not the either partner or the person who's done the betraying. So I'm able to sit there, and oftentimes I'm looking at the couple and I think, it would be so easy. All he has to do, and I'm saying he in this case because the majority of the clients I see, it is, the male is the person who's betrayed and the female is the person that's been betrayed. But it doesn't always happen like that. In fact, we have quite a handful of cases right now where it's the opposite. But for simplicity, I'm just going to say him in the moment. And now I don't remember what my point was.
No, that you're saying that in those cases we're talking about the reaction of the
immediate defensiveness. Yes. And that defensiveness is an immediate, it'll destroy any opportunity for relational healing. It'll immediately destroy, because what a partner needs is the empathy and the understanding. They need to feel validated. They need to not only feel validated, that's the first part, but then they need to feel like you get it. You get what you have done to me. You get the depth of my pain, and you're willing to sit with me in that pain for as long as it takes until I start to feel safe again.
No matter which avenue you come in.
Correct.
Right? Whether you're I made it a doctor, the cheating doctor who gets with a nurse, and that's an isolated episode, or if you're a serial sex addict, right? That coming in and saying, why aren't you getting over this?
Yes.
Represents a degree of entitlement and lack of empathy that it may be there, and forget about judgment, but if you're in the business of healing the relationship, right, that has to be addressed.
Absolutely. And here's the thing about the model that I use is I believe this has to be addressed at the very beginning. So traditional treatment and the way a lot of clinicians practice is that when an addict comes in, or I'm going to talk about addiction for a second, specifically. If a sex addict comes in, we have to get him sober. We have to focus on relapse prevention. We have to give him tools. We have to start looking at his family of origin trauma, all of that. And the partner's really left out of that equation. My belief is that from day one, you must incorporate the partner trauma into his treatment immediately. And I'm not saying that the whole session is about the partner. I'm talking about starting with education, starting by telling that person, let me help you understand what your partner has experienced, right?
Even if the partner doesn't know at this point.
If the partner does, well, I have to tell you that 9.9 out of 10 times the person coming in has been discovered already. Most sex addicts don't come in because they on their own said, I need to get help. Some do. I've had some cases over the years, but very few.
So I'm going to look at just from a different lens than sex addiction. Let's take substance abuse or food or anything but the sex addiction, right? In the context of the person's disease, an expression of it, there could be a first cousin of sexual acting out, prostitution, right? Some sort of emotional affair and so forth that's been kept secret, right? I would say, I mean, the numbers are ridiculous. I don't have a statistic, but it's outrageously high that in a committed relationship, there's been a betrayal,
yes.
right? So business as usual in the rooms, right? In the 12-step rooms you have to be very careful about how you heal, right? So it's not just an automatic that you walk over to your partner and say, I'm here to make my amends.
Right.
Right? There's factors that are considered, right? And we've spoken about, I think we once touched on this in a previous conversation. There are factors, and we didn't, we said this is going to be part of our discussion. I don't know if you remember.
I do.
So there are factors that are strongly emphasized, be very careful that your reflex of purging that,
correct,
while you get it off your chest,
yeah,
and now you're clean.
Yes,
you've just handed somebody, right, a boatload of betrayal, and if there are other people affected, children and so forth, what have you done? Right? What's your take on that?
Well, I think it's a huge problem that happens. I think so. There's something in our field called a formal disclosure, and that is a very structured process. It usually takes a couple of months, and both people are prepared for it and come together to hear all the information that's been, it's often accompanied by a polygraph test because partners have been hearing things in stages for so long that it gets to a point where they're like, well, why would I believe that this is everything? And a safety plan is part of that. So typically it's no contact for the 48 to 72 hours. You arrive separately. You don't stay together for the night. If there's kids involved, you've made a plan. Like that's part of the preparation period to figure out what are these couple of days going to look like until we get back together for our next session. And that is the best way to disclose betrayal, because otherwise if you're just to get it off your chest, going to disclose it right before, let's say your wife is about to put dinner on the table and she has to show up and be a mom, right? A couple minutes later or show up for her job. It's an incredibly irresponsible thing to do. It's important to give all the information. I am 100% on board with a complete full disclosure so that a partner can know all the information and make informed decisions about what she wants to do. But I really do feel like it has to be done in a very structured way where safety is the most important.
In a therapeutic environment.
Yes.
So I don't think just sponsor to sponsee, hey, you should do it when you have time over the weekend's going to get it done.
No.
Right? So question for you. So the culture, old school culture, 12-step culture would say to you, are you saying that all people that it's 100% of the time the right thing to disclose? How could you say that? What about the casualties that are going to be affected with the rule of disclosure as a rule, right?
Well, I hear that a lot.
So yeah, I'm just curious, how do you respond to that?
Well, I say, you're saying that it's hearing the secrets that's going to do the damage, as opposed to the damage was done by the secrets, by the behavior. That's the damage. And while it's going to hurt somebody, I've been working with this population, Adam, for I think 12 years. And over and over and over again, what I see devastation from people that hear about betrayal at every level, but the ones where it's been disclosed faster and with more accuracy and thoroughness and all of that, a partner always wants to know the truth. That's what she wants. So is it going to be hurtful? Yes. But the hurt was really not in the disclosing of it. The hurt is in the behavior that you're now going to be disclosing. So I think that that's a really great way to use an excuse to not be completely honest. I think it's a wonderful way that people have found to say, no, it's going to hurt somebody else. We're not supposed to make amends when it's going to hurt somebody else. And I look at it as it's going to be hurtful information, but you've got to take responsibility for what you did.
And if you don't, there is a fracture in the atmosphere that even if it's not labeled or in conscious awareness, it's in the atmosphere.
Yes.
And is that the reason why you encourage disclosure? Because of that fracture, even if it's unknown, right? The fact that it's there is an intimacy blocker.
Yeah, I mean, you can't have you asked earlier about a healthy relationship, right? In my opinion, you can't have one if there's secrets and secrets and lies. And even if the other person doesn't know, because here's the other thing, even for the person who's done the betrayal, particularly if it's a sex addict, typically that person has had trauma and has a whole view of themselves that includes the idea that if she knew what I have done, she would not love me anymore. If she knew this, she would leave. And so every day he's looking into the eyes of somebody and he believes if she really knew me, she wouldn't be with me. So the disclosure, in my opinion, is so crucial because after that, if a partner stays, and let me tell you that way more often a partner will stay.
Really?
Yes, it happens. I mean, with me, with my caseload, absolutely. Because when people are working to repair the relationship, really doing it and not asking, when are you going to move on? How soon is it going to be? And all of that, people stay, right? But they need to know who you really are.
So that's a really good take-home point for me. Because if I'm thinking about all of the countless people who would look at you and say, are you crazy?
Mm-hmm.
Right?
Yes.
Meaning I know more of the betrayers,
mm-hmm.
Right? So if they would speak to me, they would say, no way. She's for sure going to, right? And you're saying not so simple.
Mm-hmm.
Not only not so simple, it's actually not the truth.
Correct.
Right? If presented in the right way. So I want to spend the rest of our time talking about this. So what does healing, and if one of the objectives after I decide to work with a you person,
mm-hmm.
right? What does healing look like? And how do you, and do you come out, do you witness people coming out, with those ingredients of health, the trust, the safety? Do you witness it after this process?
Yes, I do. I'll tell you quite honestly, I would never do this work. I tell that because clients ask me all the time after really tough sessions, how do you do this? What in the world would make you want to do this? And I say, yeah, it's really hard, but there's nothing more rewarding than to see the healing. And I see it. I see it pretty regularly. And so to me, healing looks like the repairing or the reestablishing of safety, foremost, the most important, and then the development or the repair of trust in a relationship. And then with that, there can be the restoration of intimacy and connection in a relationship.
So when you're restoring safety, so we spoke earlier, like for those listening who are the betrayers, right? And this isn't an indictment against you, right? Like you were saying, you have your own
Oh, I have
history.
so much compassion
right.
and
You
empathy
have your own,
for anyone.
You have your own
Yeah.
history. It's
Yes.
not, this isn't like we are, partnering in castrating the betrayers, right? It comes with compassion too, right? But what you're saying is cardinal sin. Go in there and start blaming.
Right.
Right? The big no-no, right? So how do you establish safety at the onset of treatment? What does safety look like in the space of, I've just had this discovery about my spouse partner that's leveling my world?
The most important thing is to establish boundaries. And so the partner having a therapist to work with to figure out what does she need to feel safe. Now, I will say that her boundaries in the beginning, before she knows the details, before she knows everything, is going to look different than what her boundaries are going to look like after she's had a formal disclosure and she really is clear. But it might be that she needs her husband to move out of the house. It might be if she does know that pornography, for instance, has been a big part of the betrayal and the addiction, she might request that he put a porn blocker on or an internet filter on his computer and on his phone. A lot of times a safety boundary would be, you can't travel without me, once learning that somebody who travels for business often was acting out. Right. So safety is really created in the beginning by setting and agreeing to very specific boundaries.
To the betrayed? Meaning, let's say I'm the betrayer and my partner wants to recycle the conversation. There are triggers in the environment. I bet you went there with her, right? So is there
so you're thinking about safety for him?
No, I'm asking is if the boundary setting in safety is a two-way street, or is it mostly compassion to the person, to the betrayed?
I would say, in all honesty, in the very beginning, stages, it is the latter of what you just said. It's really more about containment and safety for the person who's been betrayed.
So I'm here, like you said, I'll live in, I'm going to live with, I'm coming in with regret. If you need to do this 20 times a day and have that, I'm exaggerating, have that discussion, I'm here and receptive, right? It's your time to be, I hurt you, and I'm accepting responsibility for that. If you need to revisit this, that's okay.
Yeah, and I actually can share something really important about what you're saying and put it in scientific terms, which I think is very helpful for people. The brain and betrayal, right? So when a betrayed partner finds out about the betrayal, it's not just her amygdala that starts to go off, that fire alarm, the threat of danger, like you're in danger, you're in danger, you're in danger, but also the left hippocampus is impacted, which a colleague of mine describes as a filing cabinet in the brain. And when betrayal is uncovered, it's like all of those the filing cabinet just gets turned over and all the files go out on the floor and they're disorganized and disarray, right? And the person who just lost all the files is now constantly trying to put it all back together and make sense of it.
Right. And it's timeless, meaning time starts to lose perspective when the hippocampus is gone too.
Correct.
So the emotional memory is just there.
Yes.
So that accusation or indictment, if you keep bringing this up, you said earlier, you look crazy,
right, is
actually a traumatic response.
Yeah, it is actually, this is proven, this is science, they cannot help it. A traumatized partner who's revisiting it over and over and asking the same question again and again, it's like this hippocampal review and they cannot help it. And the person who has betrayed them must learn this. This is why I'm saying that having the partner trauma integrated into his treatment is paramount. Because if he's going to a sex addiction therapist and that person is, teaching him how to be sober from the acting out, but in no way is teaching him about the damage that has been caused by his betrayal to his partner who he wants to stay in a relationship with, then he might be sober, but his life is a mess and he's miserable because relationally things are a disaster.
Right. And it's not an empathic this ability to put yourself in someone else's shoes, you're saying it should be from the onset. It's not something, it's hard.
Correct.
It's a hard thing for an addict to do.
I remember when I worked many years ago at SRI, my experience was that, and I was very new, I was still an intern, and I kept saying to people who said that addicts don't have empathy in the beginning, I was like, but I see all this empathy. I really see these guys seem so remorseful. And I'll never forget, my boss said to me, no, what you're seeing is remorse for themselves. They, at this stage, feel bad that they've been caught. They might feel bad that their partner's hurt, but it's really, they can't believe their life is in such upheaval.
Do you agree with that?
I think what I have learned over these years is oftentimes, yes, there is definitely at least I can say there's a huge difference in the level of empathy in those early stages and the level of empathy that comes, through the process. Because at the beginning, an addict's shame is completely exposed. They are mortified, and it's very difficult to stop focusing on themselves and to focus on their partner. Addicts are very, self-focused.
So we get through the safety piece, right? It's going to be tough for the addict who's betrayed.
And that's, again, why their therapist needs to help them understand why these boundaries are so important and why you need to say yes to them.
And you can't beg for relief. You can't go in. You have to give the space. What does trust building look like?
So I would say that doing the formal disclosure is crucial. It's like a foundation in order to rebuild trust, because if the partner never finds out everything that's happened, how are they supposed to trust in in building a future? So the formal disclosure is really, really important as a foundation. And then new boundaries are established, because as new information is discovered, right? A partner might say, oh, I didn't realize that was happening. I don't feel safe with this. So now, based on the information I got in this disclosure, I need to set this boundary. And it's really important also to say about boundaries, it's not about punishment ever. It's about what a partner has been betrayed. How can she feel safe knowing what she's learned in order to stay in this relationship and try to heal it, right? So lots of boundaries. And then here's the other thing about trust. The only formula we have is consistent, measurable actions over time. So not 30 days. You know, when an addict says, I've been sober for 6 months and I'm going to all these meetings, like, what else do you want from me? Or like, isn't it time to move on? Well, no, it's been 6 months. I found out that
a decade of this stuff.
Right. Our
Right.
whole marriage sometimes. So trust takes a lot of time, but it's the willingness from the person who has hurt the other to do whatever it takes. And I want to say, I'm not saying accept abuse, and I'm not talking about things that are unreasonable or not safe. I'm talking about being able to fall on his sword, recognize that he's got to put his partner first, because from a triage standpoint, if you guys went to a hospital and you might have a broken arm and your partner is hemorrhaging blood and they're understaffed, who are they going to take first?
So in a similar way, you talked about a return to intimacy as the final, not the final chapter, but one of the, that comes, after safety and boundaries and after trust over time. Does it have the same formula of I start to feel the safety and the honoring of my boundaries, therefore we can re-engage in intimacy, and that's going to could potentially invite a whole new host of challenges.
Are you talking about sexual intimacy?
Yes. or any intimacy.
Kind of physical intimacy? Yeah.
Or any expression of love, whether it's verbal or physical.
Yeah, this could be an entire podcast in itself, because even when partners start to feel safe again, they are so scared of letting their husband or their partner know that they're starting to feel safe. They're very scared of saying, I can forgive you, because they are terrified that once he thinks that she's quote unquote okay, or she has a good day, or they do have sex, then he's like, okay, well now things are back to normal. Now she's okay. So the next time she gets triggered, he might say, I don't understand. Why are you triggered now? You were fine yesterday. Right. So that's the first thing that's important. So oftentimes a partner might not feel safe having sex because she's so afraid that might be the thing that lets him think we're okay. I'm okay. And now everything can go back to normal. So sexual reintegration and just physical intimacy of any kind is an important part of treatment. I mean, there's a book about this, that we often have clients use as they're starting to approach reintegration.
So I wanted to accomplish 2 more things in the little limited time we have.
We don't have a lot of time. I can talk forever.
You have
There's so many things I haven't even said.
A note to self is that this is for anybody listening, this is a real skill set that I wouldn't assume that a generalist of a therapist who went to graduate school and got a license, please don't assume it's a given that any therapist knows how to walk somebody through this.
Thank you for saying that, Adam.
So that's number 1. Number 2 is I want to hear quickly just a story that blew you, and obviously disguise and whatever you need to do, a situation in a nutshell that just blew your mind, that blew you away, that they healed.
Oh, that they healed. Okay. Actually, I have this particular couple that I'm thinking about. I interviewed them in one of my podcasts. So you can ultimately go to the Helping Couples Heal and hear it. It's called John and Jane. And those are not their real names. But that was a story that was, I never believed in the early stages that they were going to be able to get through it. I believed that they could individually both heal. But the relationship was so traumatized. And it was one of those, it was like a crisis situation that went on for years. And he was not getting the trauma piece. He was doing great with his recovery and his sobriety,
but not the empathic part of the
correct
of how the betrayed is affected.
Exactly. And I will say I do these couples workshops, and I did my very, very first one back in, I don't remember what year it was, but it was many, many years ago. And this couple was in there. And I'll never forget something he said to me. He was furious because he'd been in recovery for approximately a year. And again, was doing it all right, had a sponsor. He was like the poster child for recovery. But his relationship was like a train wreck. And he's listening to all of the stuff that he's hearing in this workshop about partner trauma. And he came up and he said, why did I not get told this earlier? Why am I hearing about this now? And that's why I say you have to integrate this piece from the very beginning.
So, final piece. For those who have not arrived at a place of betrayal, right? Mm-hmm. But there are a lot of people listening to this who are in the community of recovery, and they're totally capable.
Yes, yes.
So a word to the wise from Marnie. What do you say to the couple who's starting anew or have been together and for a while, right? In the community of addiction, what's your words of wisdom?
Get help. Preemptively. Yes, exactly. Because most often the damage is done because people don't get help soon enough. So if you're listening and you know that you're struggling and you're resonating with this stuff and you feel like we're talking to you, we are. And what I would say is go in preemptively and get help. Listen, if you're not in love with your partner anymore, or you want to leave a relationship, there's nothing wrong with that. Cheating is not the answer. It's going through the process of ending a relationship lovingly and consciously, right, in order to then move on. But if you're in a relationship and you don't want to destroy that relationship and you want to have it, it's going to be a traumatized relationship, and it is hard to put the pieces back together. So stop everything and get help. There's so many wonderful therapists.
And speaking of that final piece, how do we reach you if we need to contact you?
My website is lacrh.com, and all of my contact information is there. And my podcast for more information too is called Helping Couples Heal, and you can go to helpingcouplesheal.com for more information about that.
Thank you so much. That was a wealth of information.
Thank you.
And we just scratched the surface.
I know, we got to do it again.
Loved it. Thank you.
All right.
This podcast is for general information and entertainment purposes only. This should not be considered treatment advice, nor is it a substitute for an individual treatment plan. If you have questions or concerns about your individual situation, it is strongly recommended you consult a licensed professional to talk about things that are specific to you. If there is an emergency, it is strongly recommended you seek treatment at your nearest emergency room.